Hello, I am Prasamsha Rai, and today we are doing presentation on scope of practice by RNs, VAPs and LPNs, and we will shortly have Ella on our presentation. And here is our delegation scenario. So we have Zil, a 41-year-old female who is postoperatively admitted after a bilateral mastectomy, and there is order for her vital signs that needs to be assessed every 4 hours. The patient has bathroom privileges and her fluid intake and output needs to be measured. Her JP needs to be drained every 6 hours and the output needs to be recorded. She also has orders to use incentive spirometer 10 times every hour, and she needs to sit in chair with assistance today. On her post-op day 1, she needs to ambulate with assistance and her Foley catheter needs to be removed. If she doesn't void within 8 hours after removing the Foley catheter, then her bladder scan needs to be done. And the dry dressing of her incision site needs to be changed, cleaned with alcohol, and betadine also needs to be applied there in the morning. She has medication order of oxycodone with acetaminophen 5 mg over 325 mg, and 2 tabs need to be given by mouth every 4 hours per needed with mild to severe pain. Now let's talk about the tasks that can be done by CNAs or UAPs. So CNAs generally assist clients with basic hands-on care like bathing and maintaining their hygiene. In this scenario, CNAs can take Mrs. Zill's vitals when her condition is stable. They can also assist her with ambulation and changing position every 2 hours so they can avoid pressure ulcers. And CNAs can also assist Mrs. Zill with feeding if she has no shallow percussion, and they can remind her and encourage her to use incentive spirometer. And last but not least, they can also measure Mrs. Zill's input and output fluid.
Hello everyone, my name is Ella Nottingham, and today I'll be talking about the roles of the LVN/LPN and the RN in delegation for our postoperative patient Jill, who is recovering from a bilateral mastectomy. First, I'll start with the LVN/LPN. The LVN plays an important supportive role in patient care. For Jill, the LVN can collect urine samples, administer oral medications like her prescribed oxycodone with acetaminophen, and perform non-sterile dressing changes. They can also administer oxygen therapy and adjust the flow rate, but only under the RN's direction. Another important part of the LVN's role is monitoring the patient's condition and reporting any changes to the RN right away. Their work helps maintain continuity of care and allows the RN to focus on more complex tasks. Now moving on to the RN, which has the highest level of responsibility in this delegation structure. The RN is responsible for completing Jill's initial assessment, which sets the foundation for her entire plan of care. The RN also creates the nursing care plan, deciding what tasks should be delegated to the CNA and LVN. For this patient, the RN will also handle sterile wound dressing changes, which require advanced skill, especially because Jill has a fresh postoperative incision. In addition, the RN is the only one who can administer IV medications and provide patient and family education, such as teaching Jill what to expect after surgery and how to care for herself during recovery. Overall, both the LVN and RN play essential roles.